Okay, this podcast is brought to you by K-Drama. Because if you hear laughter in the background, it's because I have family members watching a K-Drama in the other room. And if you don't know what a K-Drama is, then just look it up and you'll know what I mean. Okay, in this podcast, I want to give you an overview of a chapter from an intro to a psychology class that's typically called consciousness. And along the way, I want to talk to you about some highlights and some important points that is covered in this kind of course. And consciousness has to do with all the different kinds of things that affect our waking lives and our sleeping lives. Okay, so we have different levels of consciousness. So on one level, we have wakefulness, where we're aware of how we're feeling inside. And we're also aware of what's going on outside our body in terms of sensations. Is it hot, cold? Is it humid? And is it bright? Is it dark? And so forth. Okay, so we have sleep, we have wakefulness, and that's a basic starting point. So oftentimes in a consciousness chapter, one of the first things to understand is that our sleep cycle and wake cycle is determined by the rotational forces of the earth and the moon. We have a rhythm called the circadian rhythm. And oftentimes, if you've traveled internationally and felt jet lag, and that is when our circadian rhythms and sleep cycles are off, in a sense. And that's a very interesting subject to cover. And another general area of a consciousness chapter is about sleep. Not only, and I think I'll phrase some of the podcast overview chapters in terms of questions instead of trying to state some just a whole list of facts of what to expect. So for instance, how important is your sleep? Is sleep deprivation a problem? Or is it just something you can just push yourself through with some caffeine pills and so forth to get your work done? Or if you're a truck driver or work the midnight shift and a night shift. And what is the long-term effect of working an overnight shift where you're opposite of what would be considered a normal pattern of being working during the day and sleeping at night? Okay, these are very important things to consider. And what is the purpose of sleep? What does it do when we're sleeping overnight? Does it serve a particular purpose? Do we really need to get our 7 or 8 hours of sleep? Is it okay to get by in 5? You know, I'm a college student. I have a lot to do. I have a lot to study, so I'm going to cut back on my sleep. Well, that's something you'll discover. You'll learn about the different stages of sleep, what's called rapid eye movement, and when is it that we dream? What is the purpose of dreams? What are the different theories that help to explain what our dreams mean? Okay, and okay, I was going to tell you about a dream of mine, but I think this fits into one of the theories you'll see in the textbook, so maybe you can look it up. And I'll just give you this example. So this recording is made, this particular podcast is made during the COVID-19 shut-in of 2020. And to be honest, I'm a very fairly active person, but only when we're traveling and constantly in motion. Do a lot of walking and hiking. And since this shut-in, I really haven't been, to be honest. And so I'm slowly developing what we men call a spare tire, okay? Not that I've gained 20 pounds, but, you know, it's the shape and the redistribution of fat. Anyway, not to go into too many details. So the shape of my body is changing, and I had a dream just a couple of nights ago that I was back to my really fit self. That spare tire was gone. Okay, so your job is to look through the chapter on consciousness, and you try to figure out what the interpretation of that dream would be for me. Okay, so on the flip side, many of us suffer from sleep problems or disorders. And I think when you look at this particular chapter, there are some clinical disorders that are discussed, both in terms of sleep problems and as well as substance abuse and the different classifications of substances, stimulants, depressants, hallucinogenics, and so forth. So the reason that you might find, well, why is drug abuse and substance abuse talked about in this chapter is because these are substances that affect our consciousness, right? It affects how we perceive pain and how we perceive the world, especially if we start to hallucinate taking some of these drugs. So oftentimes the different classifications of legal and illegal drugs and addiction is discussed within this consciousness chapter. And along with that is the introduction of a textbook that you normally might, a book that you more normally might discuss in a clinical disorders or mental disorders chapter called the DSM. It's called the Diagnostic and Statistical Manual of Mental Disorders. And this is the book, just to give you a quick overview of what this book is, where clinicians in training look at the book, and it classifies all the different categories of what are considered mental disorders by the psychiatric and psychological community used in a clinical setting. And primarily, it's also a list so that, just like when you see a regular MD physician for your appointments, they need to write down a diagnostic code, and those codes are then translated to health insurance companies, and then they know how much this is worth in terms of treatment and so forth. So these kinds of classifications are unfortunately necessary, but very few people's mental disorders are perfectly described in this book. Okay, we often have some of them or most of the symptoms for a particular disorder, or a blend of different disorders and their symptoms. So that's an aspect of the DSM that we'll talk about later on, usually at the end of an intro to psychology course when we talk about treatments and disorders. But it's introduced here since we're talking about substance abuse and disorders. And let me just give you a quick explanation of how is it a clinician is able to diagnose someone with a disorder. And this could cover almost any kind of disorder, from eating disorders to alcoholism, to a drug disorder, and to a personality disorder or depression or anxiety, right? A lot of these things we experience in our everyday lives, and they're not affecting us in a negative way. A lot of people drink socially. A lot of people may use marijuana socially on an occasional basis. And so how do we know that someone is just drinking in a so-called normal way? I don't want to use the normal, but in a way that doesn't negatively affect them, versus a way that qualifies one as a disorder. Well, the way the DSM works is that there's a checklist, a very specific checklist of symptoms that describes perhaps how often someone does something and also how long something's been happening. And the most important criteria that you can just remember this now in terms of your everyday lives and how you observe your friends and family in terms of is someone going down the wrong path or exhibiting problems? Is there a significant change from their prior patterns of behavior? And is their behavior maladaptive, the opposite of adaptive? Is it hurting them? Okay? Is it causing significant harm to themselves or other people? Right? So if someone's a social drinker but gets the job done, is very responsible, never gets a DUI, and the drinking doesn't ever affect them negatively, then it's usually not a problem. But if the drinking starts to cause pain, they start to lose hours at work, put themselves in harm by drinking under the influence. I mean, driving under the influence, or operating machinery under the influence, or not fulfilling their obligations, not paying bills because they're spending too much money on a substance, then that crosses that line where an expert clinician will start to say, okay, this is starting to check a few more boxes that this person has more problems than the average person who is using alcohol or substance. Okay, so that is something to keep in mind when you are reading about disorders, and how is it that a psychiatrist or a psychologist can actually diagnose someone with a problem versus someone who's just having everyday ups and downs or everyday experiences. Okay, and those are the general categories that you'll find in a consciousness chapter, and some professors will cover more than others, or some might even skip it. But I think it's an interesting chapter. I think a lot of students are interested about sleep patterns. Not getting enough sleep is a very common college student experience, and a common experience for most people out there. So if you're not a student of mine, if you're listening to this, I think it's really important to dig a little deeper. TED.com has several great videos talking about the importance of sleep and the functions that sleep provides us in terms of the healing properties, restorative properties of the brain, how it helps to gel our memories that we've learned during the day, and whether getting a couple extra hours of sleep or a couple of extra hours burning the midnight oil studying for an exam, if you had that choice, which one would you take? Which is better for you the next day? Well, that's something I want you to look up for yourself. Okay, I think that's about it for this overview of the consciousness chapter. I hope it was useful for you. And this is Dr. C, and I will talk to you next time.